Before, the idea that or the knowledge that we had was that the COVID spread to you through droplet, which will not remain in the air for long, and that can only travel about maybe 3 feet. But now it is seen that in the closed space where there is a lot of people, gathered, so we see that there is aerosol happening. Aerosol means airborne spread happening. So if the ventilation is not adequate, so in these situations, the children or even adults will get infected through air.
So welcome Dr. Prakitish Bora to the discussion on COVID-19 and how our medical experts and doctors see the situation going forward. Dr. Bora, I would like to start off by, since you are a pediatrician, I want to ask you by understanding how the situation of COVID-19 is in Assam and in Guwahati.
Yeah, it's absolutely in a very bad situation as of now, and it is increasing daily. And the worrying thing is that more young children and young adults are also getting infected. And the conversation that I had with my friends in Delhi and Mumbai, so this time on with the second wave, there are a lot of young children getting infected. And what we saw last time was that the young children did not have very serious or severe diseases with COVID, but this time on they are coming across with children or young adults who are having serious pneumonia and serious disease with COVID as well. So yes, it's absolutely alarming. But as of now in Guwahati, what my experience has been that we are seeing more number of children every day. I'm seeing more children, coming positive with COVID. But as of today, I can tell you that the severity or the serious illness that we come across with COVID has not been that much. But in the coming days or coming weeks, I'm sure the numbers will increase, and we are bound to see some children who will come with serious disease of COVID as well.
So, doctor, given that situation, do you think children also can get vaccinated? Should children also get vaccines?
The priority has to be given to people who are more than 50 years, because that is the area where adults have comorbidities and they suffer from a severe disease more often. So priority is already being given to them. So when we have surplus of vaccine, I'm sure the young adults, the people who are more than 18 years are also being given, will be given vaccine from 2nd of May. So UK is the only country who have decided that probably from August they'll be vaccinating children who are below 18 years of age, or people who are below 18 years of age. So the safety of the vaccine will be established. It is established in adults now. So obviously the people, children below 18 years and pregnant ladies, they are the second categories, who are obvious, most often, are given vaccines or any other drugs for that matter, always, after adults have been proven to be, safe, the drug have been proven to be safe. So once UK gives it, I'm sure there'll be other countries who will be also proceeding with the same thing. And once we know that this vaccine is safe in children, and I'm sure India should also take the step to vaccinate the children as well, because for two things. One is children may not have the serious disease, but if they get infected, because they mingle with grandparents, they mingle with other adults, so they will have the potential to infect other people. So to reduce the spread of the infection, it is important to vaccinate children. And number two is the safety of the children per se. We no parent would want that their child should suffer from COVID. So the only way to protect them is by vaccinating them.
So we understand that if children, because they don't have comorbidities, so therefore the infection in children, the severity of the infection in children will be that much more reduced than an adult who is likely to have a comorbidity, or people who have comorbidities. But children therefore can be potential carriers of the disease because they can
Exactly.
infect the others. So in that case, doctor, would you say the treatment for children would be is different from the treatment for adults who are COVID positive?
See, COVID is one disease which is more or less similar in young people and in the adults. Uh, in terms of symptoms, yes, there's a bit of difference. Like, I saw a child 2 or 3 days back who just had repeated vomiting, and he did not have fever, he did not have any other coughing or cold or anything, any other problem, but he turned out to be COVID positive. So it was only pure vomiting that was the way of presentation. Then I had another child about a day back who had just red eyes and nothing else. And because this symptom was not fitting into anything, so I tested him for COVID and he came out to be positive. So we are seeing a lot of variety in terms of presentation in children. But in terms of management, when we try to, manage a child, so the management protocol remains the same. So we try to divide them into three categories: mild, moderate, and severe. We are not seeing children with moderate or severe disease in bulk now. So only one or two children that we have seen that has gone on to have moderate or severe disease. And in these children, the medication that we order for adults, like steroids, remdesivir, so this kind of medications will be given to them as well.
And even oxygen levels, do you think children also will have their oxygen levels go below 94? And can that be a situation which we can anticipate with serious cases insofar as children are concerned?
In Guwahati, we are still, expecting that, since we are seeing the wave, in the increasing trend now, so we'll definitely have children coming with pneumonia and, low levels of oxygen. But as of now, we are not seeing children of that kind. So, but, after talking to our friends and colleagues in Delhi and Mumbai, who have explained to us that they are seeing children with this kind of situation. So once we have that kind of situation here also in Guwahati, I'm sure they'll require oxygen, and the other drugs, as I mentioned just now, like steroid, remdesivir, will be needed for this kind of children as well.
I see. Doctor, so what must parents do to keep their children protected? Is we know that we talk about the different COVID appropriate behaviors, the different protocols like hand sanitization, washing your hands. We talk about masking. What else must parents do to keep their children protected from contracting COVID?
The protection methods will not change. It will more or less remain the same. But I would like to ponder on certain small things which parents or adults we tend to forget. Like a child has a smaller face, so the mask that we provide to a child may not fit appropriately. So one has to be, when if we are taking our child out, then the parents will have to make sure that the mask that the child is taking has to be appropriate. It has to protect the nose and the mouth in the proper way. The fit of the mask has to be appropriate. So that is one thing the parent has to see, because now we know that mask is one leading or foremost thing that will prevent COVID from coming to you. So that is one thing, that smaller fine things that about mask one has to be alert about. And secondly, now with the second wave we are seeing that the mutant variety can come to you through air. I mean, it is basically aerosol borne. Before, the idea that or the knowledge that we had was that the COVID spread to you through droplet, the bigger water particles that come out from a person's nose or mouth, uh, which will not remain in the air for long, and that can only travel about maybe 3 feet. But now it is seen that in the closed space where there's a lot of people, gathered, so we see that there is aerosol happening. Aerosol means airborne spread happening. So if the ventilation is not adequate, So in these situations, the children or even adults will get infected through air. So maintaining, adequate social distancing, social distancing should be at least 1 meter now, that is 6 feet, and avoiding crowded areas in a closed space where there is not much of ventilation. So if one has to go to a closed area, then there should be adequate ventilation. Preferably, closed spaces should be avoided. Uh, uh, Outer area, spaces in outdoors are much better, like being in a park. You have to maintain all the protocols, but then being in a park, because there is airflow, there is good ventilation, the chances of acquiring the infection will be lesser. So that is another thing. Then the third thing would be sanitization, washing your hands and keeping your hands sanitized, because hands are the carriers of all the microbes. It is not only COVID, all microbes will come through your hands. So sanitizing and trying not to touch your face, or the areas where there are holes in your body, like the nose, the mouth, the eyes, the areas where the microbes can get into your body, should be avoided by your hands. So I think these are a few things. And on top of that, because you don't have anything against COVID, so what you can do is, amplify your immune system. So to amplify your immune system, there are two things you can do. One is to have a good and nutritious diet. The number two being to give your body good exercise. So if there is a good physical activity, your body is fit, and if you are taking a good nutritious diet, that builds up your immune system. So, and building up your immune system will definitely prevent COVID from coming to you.
Doctor, how about pregnant women? Are they at a higher risk from COVID-19?
To my knowledge, whatever the data that I could go through, it has not suggested that pregnant ladies will be under higher risk to develop COVID infection. But because the pregnant lady is carrying a child within her, so it is twofold. The risk is twofold. I mean, to her as well as to her the baby that she is carrying. So a pregnant lady has to be extra careful in not contacting the disease as far as possible.
Can the virus be transmitted to the fetus, doctor?
We do not have scientific data on that. So I'm sure studies are going on that, but then as of now, this is not vertically transmitted. Not vertically transmitted means the virus does not go from the mother to the fetus. The mother gets COVID infection, probably she will not transmit it to her fetus, which is a good news. But again, this is under evaluation. This is under trial. So more data needs to come to us for a
Ha-
final word.
Have you come across any case in Guwahati or from anywhere in Assam where newborns have been infected by the virus, like we have seen in other states in the country? And also in Brazil, there are a number of cases of newborns and babies actually contracting the virus.
I have had a couple of mothers who were positive and who delivered in our hospital last year. But the babies, they came out to be negative. So that is one reason why I'm saying that vertical transmission probably is not happening. So what we needed to do that time was we kept the baby away from the mother, and once the mother became negative, we shifted the baby. So as of now, I do not have the experience where both the mother and the baby were positive, and we had to deal with a situation like that. But across the world, there have been instances, and this is possible. So I'm saying that this is possible, and we are geared up with the knowledge about the situation. But as of today, we can say that we are fortunate not to be dealing with situations like this.
Would you, doctor, recommend that pregnant women get tested for COVID-19? Is that a recommendation that doctors and medical experts are now suggesting?
Absolutely. Anybody who's going into the labor room, or anybody who's going to the OT, has to have a rapid test and RT-PCR test before they are taken into the OT or the labor room. So it is a mandatory thing. Yes.
Now, doctor, coming back to the question of children, we've seen the way the cases have been rising in other parts of India, in Delhi, and we are now seeing that there are already 1,000 cases here. Schools and colleges have been closed down by the government here. And there is also a chance of a lockdown. We have curfew, evening curfew starting from 8 p.m. today. So things are not really looking good. In fact, it's becoming grimmer. And
Yeah.
and we've also seen that this virus now infects the entire family. If one person is infected, the entire family gets infected. In families where there are children, you've already mentioned the kind of protection that must be taken, but we also have families that live in very closed spaces. In such a situation, how do you protect your children, and what must you do and if somebody is infected in the family, should you isolate the children or keep the children in some other room or send the children away to a relative to protect the child from not infecting the virus, not getting the virus?
See, Guwahati being a city where space becomes a problem. So here, anyways, when you have a positive child, it is very difficult to segregate him from the family because you are emotionally attached. How can you not, see your child or touch him when just because he is infected? The emotion comes into play here. So if an adult is positive, you can always ask him to say, "Well, you stay in this room, don't come out. We'll give you food and use a different bathroom." But restricting a child or segregating a child becomes very, very challenging. So what I'm saying is that if the entire family is positive, that becomes easier, and you can mingle easily, with each other, and just keep yourself away from everybody else in the house, or keep yourself within the house. But suppose the child is positive and the adults, parents, or other people in the family are negative, that is the area where you have the true challenge, because you have to keep the child away from you, and do not mix with him at all. So that is a real channel, which is, I think, practically, uh, in terms of medical isolation, it is not 100% possible. The social aspects involved here, is tremendous. Where complete isolation is not possible, not feasible. Even if you ask a parent to be away from the child, it is not possible socially or emotionally.
Right, doctor.
So these are areas, which cannot, medical science cannot give you an answer for that, all this.
Right. Doctor, just two final questions. One is, if parents see there are certain symptoms in the children, cough, fever, like you said, the eyes are getting red. What should they do firstly, and so that they do not? I mean, every doctor, every medical expert, every day is saying, do not panic. So, what would you suggest the parents should do whenever they see some symptoms which appear like COVID symptoms? Should they call up the hospital? Should they go to the hospital with the child? Or should they first isolate the child in the house? What are the steps that you would recommend?
See, I would ask the parents to be very calm, because they get agitated or they get upset when their child is unwell. It is very important to keep your calm. And the first thing is to do a COVID test in the nearest possible area or center, because you have to know any symptom that is like a flu, or any symptom which is unusual, like extreme tiredness, or extreme unwellness. You do not have anything, but you are absolutely unwell. No, you are not feeding. The child is not feeding. He is feeling unwell. He has pain everywhere in the body. So anything which is not usual, if you have a symptom of that kind, then the first thing you should be doing is a test. If the test comes positive, then you know that the child is having that kind of disease. And then the first thing that you should be doing is keeping the child away from the elderly people, people who are more than 50 years old, people who have comorbidities, because this child, if they infect this kind of adults, they will have severe disease. So it is our responsibility to see that people who have the potential to have severe disease should be prevented or should be protected. So If the child is positive, then try to isolate him as far as possible. Try to give him food in a particular area. Try make sure that he uses a different kind of toilet. And sometimes it is not possible for the parent, for the parents, mother or the father, to avoid the child. In that case, I would recommend that at least one parent should remain away. One parent should take care of the child and see that he does not mingle with other people. So basically, getting a test done on time and trying to isolate the child as far as possible. And if the child has mild disease, he has only fever, cough, cold, or red eyes, or some rashes in the skin, but he does not have breathing difficulty, his oxygen level is okay, then you do not have to do anything. Just give normal fever medicine, good diet, and in some cases we do give medications like favipiravir, the antiviral medication for mild disease. So this kind of medicines might be required, but keep on monitoring the child for respiratory distress, difficulty in breathing, and in terms of oxygen level, if there is a dip in the oxygen level. So if things are okay, then well and good. If things are not doing okay, then one should be consulting a doctor or a hospital for management in the ICU or in the hospital.
Finally, doctor, do you, I mean, given the present situation, do you think we are in a position, the state is in a position, the medical infrastructure is in a position to handle, God forbid, a surge if we are to have here? Already there are 1,000 cases and the numbers are rising. Do we have the infrastructure, the medical facilities, uh, the medical staff to handle such a situation?
See, last time, in terms of children, the serious illnesses that we saw was something called MISC, multi-system inflammatory syndrome in children. But those serious situations happened only once the child had already suffered from COVID. He recovered from COVID, and then he developed this condition called MISC, where his multiple organs, like the intestines, like the liver, like the heart, and the lungs, everything gets involved. And many children we had to like ventilate also, and give all kinds of ICU care to make these children all right. In our hospital, we even lost two children last year with this condition called MISC. But because these children were negative for COVID, because they had already suffered from COVID, they had antibodies. So we could treat these children in normal children ICU, in pediatric ICU. But suppose in the current scenario, when the number of children are suffering more and more, suppose we have active COVID children with pneumonia and children who are positive with COVID and they have pneumonia, they have breathing difficulty, then adults are better geared up, because last time there were so many adults suffering from serious disease. So what they did was they segregated their ICU, the main adult ICU, the normal adult ICU, from COVID ICU. But the same system is not happening with children. For children, even now we have the same ICU. We do not have a separate ICU for COVID children. But now, because the cases are coming up in our hospital, at least we are dedicating a few beds separately for which are basically isolation beds in the ICU for with the expectation that we might have children with COVID, pneumonia, and other things who might require COVID, serious COVID ICU management. So we are dedicating those beds. But suppose the number of the cases really increases to a very terrible level, then probably will not have sufficient bed to accommodate these children and to treat them in the proper or the adequate way.
All right. Finally, doctor, thank you so much. And we hope we see normal times very soon. And good luck to you and all the frontline medical workers and everyone who are facing this challenge. Thank you once again. And we hope to talk to you again very soon.
Thank you so much.